Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists. Welcome back to the Direct Care Podcast for Specialists. If you're new, I'm so glad you found me. I'm so glad you're here. If you are a recurring listener, I want to thank you so much for coming back time and time again, week after week. Every Tuesday, I've got a new episode, whether it's me sharing my experiences with you or inviting guests on. I'm really grateful that you're here downloading these episodes to learn about how you can improve your practice. This episode is going to be really fun to talk about because this is really grand scheme of things. It's big picture thinking. And it's my favorite way to share ideas about direct care with you. And it's a topic that we all think about, even specialists, which is how do we increase our cash flow without having to grind more clinical hours, right? So whether you're in podiatry, dermatology, ophthalmology, ENT, rheumatology, any other specialty, the truth is time is not the only product you have to offer to people. When you stop thinking only in terms of the hour you spent with a patient, the procedure that you performed, you will then see there are new opportunities that show up, different ways to make money, possibly even easier ways to make money. And remember, making money and helping people go hand in hand. It's not that you only are in medicine to help people not make money, or you just want to make money and not help people. That's not the type of practice we are building. We are building very thoughtfully, brick by brick, the purpose of medicine, the meaning and the joy that we first came into medicine for. And so it's always about helping people and making money. Those things must come together in order for us to have a thriving practice. So we are not going to be weird about making money, right? Today I'm going to share with you 5 real practical ways to start increasing your cash flow without having to add more clinic hours. And this brings me back to a time when I reached out to a consultant, and that was their treatment protocol for me, for my practice, was simply to see more patients. And I remember at the time I was young and I was eager and I was so willing to do what people recommended. But at that moment I realized, to what end? How many more patients do I need to see or have to see in order to make ends meet? And the reality is, if reimbursements are declining and the cost of business continues to go up, that's a losing battle. So we have to think differently. And this is so essential because this is the path of direct care. This is the future where we get to create ways, different ways in helping people that is beyond the one-to-one patient interactions. So let's get into it. The first thing to realize is that you can package your expertise so that you are selling the outcome instead of selling your time. This reminds me of a recent incident that I had where a patient who was actually also a medical professional who was not happy with the package I sold her after a few visits. She had thought that the package she purchased was intended to cure her situation. But in reality, the package that I sold her was more about access and expertise. So because there was a misalignment in understanding, she felt that she did not get the outcome she paid for, and I felt I can't really meet her needs. I just decided to refund her the remainder of her package so that we can amicably part ways, which allows me to open more room for people who are more for me, right? So the idea of having to see everybody just because they showed up or just because we take their insurance or just because they can pay is really outdated. We can't help everybody. And in fact, it could damage you more if you choose to help people who you really can't help. So this was an insightful experience for me, and I shared this on LinkedIn where I talk about why a patient requested a refund and how I just ended up refunding it There was no fights about it. There was no bashing online. It was just a simple transaction. We saw that we could not have this relationship. It was not going to be fruitful, and just parted ways. And so in that, the package that I sold her was really selling the access. In this specific incident, it wasn't an outcome other than me performing a service because she needed a maintenance care program. What she had will always come back for as long as they are walking on their feet. It's just something that we need to maintain. And if we don't maintain it, it just simply gets worse. So what I sold in that instance is the outcome with the expertise and the access. It's the access to me, whereas the alternatives, she may end up having to reach somebody else. It takes 3 to 6 months to see them. She may encounter somebody who doesn't care about this certain pathology, for example. They may dismiss her, so on and so forth. So I already know within my community what my skill set is and what is available. So I have a lot of confidence in regards to what I offer. It took time to build that. It doesn't mean that I'm cocky, and it doesn't mean that other people can't do what I'm doing, which is, as you know, I try to share everything with you as transparently as I could because I want everyone to succeed. But I also want everyone to realize what they're good at and what they're not good at, and just know when things are not aligning. Just being okay to let things go, let people pass through if they weren't meant for you. Because then that gives you room to fill that space for people who are meant to have you as their doctor. So that is one kind of package that you sell. You sell the outcome, or you sell the service, or you sell the access rather than time. And this was a very interesting situation because I've never encountered a patient who wanted all 30 minutes of my time or who wanted all 90 minutes of my time. That has not happened until now. And don't forget, I'm kind of young in the practice game. I'm rolling into 6.5 years of my private practice. I'm still learning a lot, experiencing a lot. But in my specialty, we don't bill for time. We bill for outcomes or endpoints. Like when we do a bunion surgery, they're not paying me because it takes me 45 minutes to do a surgery, right? Or maybe that surgery took 3 hours. It didn't matter because it was the outcome. It was a surgical correction they're actually paying for. So in regards to packaging, sell your expertise, not your time. So an example of a care package could be 3 months of functional medicine testing, diagnostics, and treatment plan. Or it could be a 6-month maintenance program for a chronic health condition. It could also be a recovery package for pain relief, for example, for some period of time or number of visits. So those are examples where you're not piecemealing different parts because people don't always know what they need. The consumers just know that they have pain. They just know they have a medical condition, right, that needs to be addressed, but they don't really know how many visits that takes or what treatments are involved or what diagnostic tests are involved. Which also reminds me to share with you that, when I purchased an ultrasound and I kind of gave patients the option of using diagnostics or not, they don't know. They don't know if their condition requires an x-ray, an MRI, or an ultrasound, right? That's for us to know, to help them. That's our area of expertise. And so when you give patients all of these options, it really confuses them. It doesn't really give them the confidence that you know what you're doing. And so it's almost always better to package your services as the outcome that they will get. So it could also be something like diagnostic testing. It's not a treatment, but you are offering some diagnostic answers for them. That could be one type of a package. Or it could be maintenance of some kind. So for me, it's foot care maintenance, where I see them once a month for maintenance foot care, trim their nails, file their calluses, check for other problem areas, and so on. That is a very easy one for podiatrists to offer. So package your expertise. People value the endpoint, the transformation, rather than being nickel and dimed. And the packages also commits the patient to continue to see you. And then it offers your practice predictable cash flow. And this is the model for direct primary care, DPC, where they have monthly memberships. We just call it something a little bit different, packaging, because we can do something in 3 months, 12 months, whatever you decide that packaging looks like, instead of membership. So you decide what you want to call it, you decide what you want to put into it, and then you test it out. So patients aren't really looking to spend 15 minutes, right? They just want to know, can you help them at the end of the day? And so that's why I really, really want you to think about packaging one of your services or one of your outcomes as a way to anchor your financial cushion or have predictable cash flow for your direct care practice. I've got 4 more coming for you. All right, number two, offering a high value non-covered service. So similar to packaging, but we are really now focusing on non-covered services. So things that insurance isn't covered is a really great avenue for you to invest in, especially if you already offer some of that, and maybe you just want to refocus and think about that more as you start transitioning out of insurance or you start looking to increase your cash flow. So think beyond insurance. What could that look like? It could be a wellness program. It could be regenerative therapies. It could be functional medicine, integrative medicine, nutrition, aesthetics, lifestyle medicine, that type of stuff. It could be stuff that you recommend, but you know insurance doesn't offer, and so you weren't really offering it all that much because you were met with resistance. And sometimes that resistance comes from you before it comes from the patient. So if you express to the patient, well, your insurance doesn't really cover it, and your body mannerism and the way you speak about it is energy depleting rather than excited, well, the patient's not going to have a buy-in that they would think that could be a good option for them. So be mindful about how you present your information in the least biased way possible so that you can allow them the freedom to choose what's going to work for them without judging their ability to pay. That's like the biggest insults patients have, is being judged for ability to pay or not, right? We don't ever want to judge people for that. But sometimes we do, in the subtleties and the words that we use. So anyway, non-covered services is the first thing I often recommend specialists thinking about direct care. If your specialty has a non-covered service that you are interested in, not that they don't cover and you just want to do it to make money, but something that you are truly interested in, you know that will help people, you have interest in these topics, then that's what you should think about. That's what you should really create your brand around. Because then it's an alignment of what you think is right for you and the patient, right for you, your business, and then right for the patient as far as the treatment options they're looking for. So when you reframe this and you think about what is it that the patient really wants, patients don't want surgery. You know, I'm a trained surgeon, and I didn't realize this till later on in life, where I know all these surgical skills. I've traveled around the world to learn these things from people in the top of their profession, only to realize and come back home to people saying, I don't want surgery, right? They don't care how many flaps I've done or microvascular surgeries I've performed. They don't care about any of that. They don't want to be cut open, period. And that's when it shifted for me. It made me realize that I only knew so little because I was trained as a surgeon. But when I listened to patients, I realized they wanted more and they were willing to pay for that. I help a lot of busy professionals, and not everybody can take 6 to 8 weeks off of work and have the risk of an infection and they get re-hospitalized or risk an amputation, right? So those are all of our knowledge that has been condensed that we're trying to educate the patient to understand. And so with that, I was then able to realize that with advancements in technology and scientific literature and reviewed studies, there's a lot more options these days beyond surgery. So understanding that part about my practice really helped me understand life beyond insurance. And so I do offer a lot more regenerative therapies, and I'm able to convey this information to the patient who was actually already looking for it. And it's really important to share and educate your patients that you are just helping them understand what is available to them. If they say, well, does insurance cover it? Well, you can always say something like, well, insurance defines what is reimbursable, not necessarily what is valuable, right? They're not doctors, even though they're going to function like they are one, because they make really big decisions for patients, especially on whether or not they're going to pay for a treatment. But that's where you have to make sure that you're not practicing reimbursable medicine, right? You are practicing medicine in a way that aligns with what you're offering, with your values and what patients are looking for. And that way you can kind of sell it better. So there's a difference in how you convey that information to the patient versus saying, well, I'm only going to select this option because insurance will pay for that, and there's no resistance for the patient wanting to have that treatment. That is totally different than educating them on the current options about what's available to them and then let them decide how they want to spend their money. The third thing to think about as far as increasing cash flow in any specialty is something that I'm diving into a little bit more myself, and that is leveraging educational products or digital courses. What does that mean? If you already like to teach, or you're teaching your patient one at a time over and over to new patients over and over again, right? These are things that you can start thinking about a little bit more strategically and organize it so that it becomes a digital course where they can watch it on their own. They can purchase it, watch it, and then learn some things and decide whether or not they need to come in or not. So these things are course creations. Maybe it's a master class. I see a lot of people doing nutrition courses, for example, which is just kind of a seamless way to give patients that extra time outside of the clinic, or a guide where you realize you're kind of teaching the same thing over and over again, but now you make it a digital product that you can sell based on your area of expertise. There are things that you can sell, and what I found to be most impactful are things that require more time, right? I mentioned nutrition as one. Physical therapists, they do sell exercise modules. They show people how to do things, certain movements and the routine and such. There are other people who are helping manage chronic conditions, obesity medicine, for example. There may be recovery classes for after surgery or natural remedies for home care. So many different ways you can think about this, depending on your specialty. The beauty of digital courses is that you create it one time and then you have repeated revenue. You don't have to work extra to get more people interested in your stuff. And I do this with my coaching program. So I've created a coaching program through the consolidation of what people were asking me. I made it into a digital course where it's easy to follow, and then it just lives on the internet on repeat for people to have access to. And that allows me to have recurring revenue. Now, I haven't created one for patients. I'm kind of working through that right now, mostly because I'm very hands-on. And so, in my coaching program, there's no hands-on needed. But when it comes to podiatry patients, I do need to touch, feel, and correct things and such. But down the road, I do intend on having a digital program for them. I am working on a guidebook, though, so that they can understand the framework of holistic healing. And so this is always on my mind. And once I started to learn about digital course creation, I feel like the possibilities have been endless. And now it's just a matter of me wrapping it up, packaging it into a nice pretty bow, and then handing it off to the patient and saying, here's the course, this is what it cost. So this really helps increase your cash flow. It lowers the dependency of you with one person at a time, but it's multiple people at a time. So if you see a clinical patient, you see one patient, per hour, whereas you create this course and you can help 100 people per hour, right? You get to multiply your time, your effort, and your expertise. All right. Now these last two, I will kind of tease it out in later episodes into the details of what that looks like. But number 4 is really upselling, which could be upselling to like an annual membership or an add-on feature or something that helps with maintenance, prevention, or optimization. And in number 5, you can create different tiers of your products or services. So, we talk about membership packaging for one thing that you specialize in, but you can actually have 3 versions of that. You can have like the easy access, you can have the middle of the ground of like a little bit more comprehensive or extended time, or you can have the high-end version where it does require a little bit more nuanced information in your expertise. But then you can create these different tiers so that you don't really feel like you're leaving anybody out. But nonetheless, it kind of falls back to packaging it so that it's a little bit more all-inclusive. It's kind of a no-brainer. It makes it easy for the patient to decide, let's just get the thing, and then you start to play with the numbers and see what works for you. So when you think about creating different tiers with different price points, it's also recognizing that not everybody needs the highest touch service, which is really the one-on-one. That's really VIP level. Some people just want a little bit of information, and some people are very DIYers. They just want to know how to reduce their inflammation, right? Through an anti-inflammatory diet, for instance. Or they just want to know the basics of how they can lose weight during menopause, right? So no matter what your specialty is, I'm sure you can think about different ways to create, at most, 3 tiered levels. And that way you can show them this is the low end, this is the middle of the ground, and this is the very high touch point package, and then let them decide. When you do that, it allows you to not stretch yourself so thin with just the one hourly consultation visit, right? Now you've got packages, now you've got variation, and I think you're going to have a lot more excitement because then you're going to be able to test and see what works and then tweak the things that aren't really working the way you want it to. But it gives you space to try different things and experiment and explore, which is the whole point of owning your practice. The future of specialty care is not about burning out your time, even as a direct care practice who does not deal with insurance. It's still being smarter, more intentional, and being a lot more creative about how you deliver the value with all of the knowledge you have. Sharing with patients that you have options increases your value, right? Because people will pay for expertise, and there are different levels of things that they will need. So start with one of these 5 ideas and just continue to refine it and just see how it works in your specialty. And you're going to see an increase in your cash flow because now you're starting to think outside of the box where you're not exchanging your time for money. If you enjoyed this episode, be sure to subscribe, and I would love, love, love a review because it allows other people to find this podcast. I don't put any marketing dollars to increase awareness about this podcast, and I do really rely on you to share this information with others. I also put together a free digital gift, which comes in the form of a PDF worksheet, and this worksheet is going to help you think bigger. It's called the Brainstorming Your Next Cash Flow Expansion Idea, and all you gotta do is click on the link down in the show notes. Thank you so much for tuning in. I will check in with you next time. Take care. If you enjoyed this episode, please give it a review and share it with a friend so more doctors can learn about direct care. Let's keep the conversation going on LinkedIn so we can help more doctors escape insurance and thrive in private practice. Thanks for listening. I'll talk with you next time. Take care.